Hi everybody, this is Matt. I'm starting a new series, and this is on the heart valves. The first heart valve that we'll speak of is the mitral valve, which separates the right atria from the right ventricle of the heart. The valves specifically are designed to achieve two functions, and that is one, to open and permit the flow of blood forward, and when they're closed, to prevent the flow of blood backwards. And it may sound simple, but if that doesn't work, you have trouble, and we'll go into that a little bit later. Anyways, the mitral valve separates, as I said, the right atria from the right ventricle. The right atria, and atria from the Latin is an entrance area, and you talk about an atrium of your house. It's an area where you receive people, or it's the area prior to a main room of your house. And the atria of your heart are similar. They receive blood. The right atria receives blood back from the body, and the left atria receives blood back from the lungs. So the mitral valve is closed during systole. That is when the ventricles of the heart are pumping the blood forward. The mitral valve of the heart is open during diastole. That is when the ventricles of the heart are filling and the atria are emptying into the two ventricles. So the mitral valve has a tendency in women to have issues, and it is not uncommon in young women that they have what's called mitral valve prolapse, which is essentially a weakening of one of the leaflets that permits backflow of blood. And this backflow of blood can cause a young woman to have palpitations, or a little bit of a rapid heart rate, and be a little short of breath if it goes on for very long. So if you know someone who is relatively young, a young female, who has issues with palpitations, then they should be checked, because this could be detected initially by just listening to the heart with a stethoscope. There would probably be, if it was found there was a murmur, which is the sound of the backflow of the blood, they would probably want to do an echocardiogram to validate that finding, and there is treatment for that. So anyways, the mitral valve can have some problems, and anyways, that is the first valve that we're going to speak of, and it is important in that it is the valve that is serving an important function in blood coming back from the body, then moving it forward from the right ventricle to the lungs to obtain oxygen and get rid of waste products, and then move on to the left side of the heart. And that's it, and we'll be back with other segments on the other heart valves. Bye.